Healthcare professionals across Saint Lucia are participating in a 4-day specialized training workshop focused on enhancing the management and treatment of diabetes in primary care. The initiative brings together medical practitioners directly involved in diabetes management, including primary care physicians, nurse practitioners, nutritionists, dietitians, pharmacists, community nurses, and home health aides for hands-on training in the application of the CARPHA Guidelines for the management of diabetes in primary care in the Caribbean and the Diabetes Nutritional Management Toolkit. This workshop is part of a regional effort led by the Caribbean Public Health Agency CARPHA in collaboration with the Pan-American Health Organization PAHO under the Subsidiary Agreement titled Strengthening Public Health Capacities in the Caribbean Subregion. Through this partnership, CARPHA is providing country-specific guidance and capacity-building support to its member states to promote standardized evidence-based diabetes care. In his remarks, Deputy Permanent Secretary in the Ministry of Health, Wellness and Elderly Affairs, Ernest Nobal, emphasized that the CARPHA Training of Trainers workshop in diabetes management is timely and aligns perfectly with Diabetes Awareness Month.
This training aligns well with this year's theme, Diabetes and Wellness, and places focus on the team approach in ensuring that all persons living with diabetes have access to holistic care, which is provided by adequately trained caregivers and health practitioners. This approach to capacity building, which includes a multidisciplinary team across sectors, is indeed commendable and goes a long way in strengthening and standardizing the care that persons living with diabetes will inevitably lead to better health outcomes, a goal that we all work towards.
Dr. Heather Armstrong, head of the Chronic Disease and Injury Department at CARPHA, explained that the workshop aims to ensure that healthcare providers are well trained in the use of CARPHA guidelines and protocols and will be empowered to help clients improve their health outcomes.
The idea is that we want to have healthcare providers who are well trained, but also have the ability to help to empower their clients so that you have productive interactions that could occur on a daily basis as we meet with our clients, because we want to have a patient-centered approach where we look at the context of the client. We're not just giving recommendations on how to manage the diabetes or high blood pressure, but rather how does this person improve their outcomes based on their situation, utilizing the protocols from the guidelines.
Family nurse practitioner Alexandra Gemot, a participant in the workshop, noted that the training was a valuable refresher that reinforced best practices and better equipped health professionals and caregivers to deliver more effective diabetes care.
I'm happy to see that we have persons from SSDF who deal with the elderly, and that they could be here, because sometimes, there's a lot of persons who are at home with diabetes, they don't have anybody caring for them, but the fact that they're here to get that training and that information, they'll be able to care for our elderly persons better. We wouldn't see, there might be a little decrease in hospitalization rates, comorbidities and so forth. So I like it, but for me, it's a refresher. And some of the figures or some of the ranges, that I maybe take for granted, because maybe where I'm at, most of our clients are controlled.
This training will cover 5 modules with the aim of strengthening and standardizing the management of diabetes in primary healthcare settings in Saint Lucia. From the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Onika Makwai.